Okay, I'm Jason Schwab. I'm a neurosurgeon. I'm the surgical director of the Comprehensive Epilepsy Center at Henry Ford. And I'm going to be speaking today about appropriate treatment of localization-related epilepsy. I think the big message that I have for people is that epilepsy is really bad and we need to be aggressive in treatment. So people with epilepsy generally are estimated to not live as long. If the epilepsy is from a known cause, they can expect to lose 10 years of their life if not treated. And if the epilepsy is from an unknown cause, they tend to use about 2 years of life. And the quality of life is poor. So if you're having seizures that affect your level of consciousness, you can't drive for 6 months after that. Most of our patients are seizing a lot more frequently than every 6 months. As a result, especially in a state like Michigan, which doesn't have very good public transportation, but really nationwide, if you have epilepsy, you're 5 times less likely to hold a job. Your risk of suicide is about 5 times the national average, and about 20% of newly diagnosed people with epilepsy feel stigmatized. There's also a high rate of accidental death. People can have a seizure and fall in the tub or fall in a swimming pool or fall and end up severely injured. And the risk of accidental death in people with epilepsy is about twice the risk of those in the general population. On top of that, there's this other risk of sudden unexplained death in epilepsy called SUDEP, which is understandably very, very frightening to people with epilepsy. And when you're looking at patients with SUDEP, you're actually not even counting the patient who has a seizure and falls and splits their head open or drowns as a result. You're talking people who just don't wake up, or a person who has a seizure and just dies on the spot. And for patients who have epilepsy severe enough to be referred to an epilepsy center like ours, that risk seems to be about 1% per year. That doesn't sound like very much, but when you're talking about a 30-year-old, that's actually very high. And when you combine the risk of accidental death from injury plus the risk of SUDEP, you're talking about a 15% mortality rate by decade. And yet epilepsy is often treated as if it's a benign disease. And in patients who are found to have specific types of epilepsy, especially temporal lobe epilepsy, we have a very high rate of curing people and reducing that rate to near zero. And just to point out some of the differences between how we as a public view epilepsy versus, say, cancer, cancer is obviously a terrible disease, and we're very, very aggressive. But when you're looking at a low-grade breast cancer, the benefit of chemotherapy is reducing mortality rate by only about 10%. And yet, when you're talking about epilepsy, you've got a rate of 15% per decade, which is higher than the risk for that patient with breast cancer. And yet the patient with breast cancer goes through the nausea associated with chemotherapy and the risks of chemotherapy and the discomfort and fatigue and hair loss and all that. And if you were a patient at a center being treated for your breast cancer and you weren't offered chemotherapy for a chance of a 10% improvement in your mortality, you would be irate, you would be livid, you'd probably be suing that center. And yet we're accepting of the fact that patients who might be cured of their epilepsy aren't offered that. So the question is, who should be referred to a comprehensive epilepsy center and see, one of our wonderful epileptologists? And there are guidelines on this from the National Association of Epilepsy Centers. And the first one is if your seizures have not been brought under control, and that means 0 seizures with change in level of consciousness. If they haven't been brought under control after 3 months of care by your primary care provider, you should see either a neurologist or, if locally available, an epileptologist. If you're seeing a general neurologist and after a year you haven't made progress and you're still having seizures, you should insist upon referral to a specialized epilepsy center with an epileptologist.